everybody still good? Like,
Lindsay had them. That's why I have pictures.
yeah, I
of.
know.
Oh, yeah, everybody's still good.
Yeah.
Why, who did you talk to?
Well, no. Yeah.
Okay.
Elaine, Mike.
A lot of people, actually.
My wife.
Oh, I did tell her. I had to wait until they said it was okay, and I couldn't put anything on Facebook yet, but David was telling, Lindsay kept going, geez, David, what'd you do? Tell everybody on your phone list?
Lacey? Lacey?
Yes.
Is anyone in Chambers that I don't see on?
Mark.
Mark's in Chambers?
Yes, ma'am.
Yes, ma'am.
Okay, hi, Mark. And then we're waiting for Ryan Foley. He's not on or in Chambers, right?
He is not in Chambers and I do not see him on.
Okay.
I just got on, Elaine.
I see you, Heidi. Thank you. Trish is on, Heidi's on, I'm on, Mike's on. And then Mark's in Chambers. So are we just waiting for Ryan and Tim, right? Is this Tim on the phone?
No, that's Keith.
Okay. Hello, Keith.
I think he said he's muting himself, but he wanted to listen in.
Okay. I won't say anything wise guy about that.
I think he's driving.
All right. We do have a quorum though. Yes? One, two, three. Where's Trish?
She's on.
Okay, okay, 1, 2, 3, 4, 5. But we do have a quorum then. I guess I didn't hear Timmy wasn't coming and I didn't hear Ryan wasn't coming, but it's 5:30. If you guys want to get started, we can certainly do that. Are we on live stream?
We are live streaming and you as the chair can make the call to start whenever you would like.
All right, then let's do it. Tonight, which is a record, we have no appointments tonight. We have only 3 resolutions. And you do see on the agenda that there is a listed executive session. But at this point, I don't see us needing that executive session. It was only put on there just in case the conversation took a turn about talking about specific individuals. But I was planning on bringing tonight a resolution setting the public hearing and establishing the local law, repealing local law number 5 of 2014. And what that essentially would do is establish 2 separate positions, one of DSS commissioner and one of a mental health director, essentially doing away with the merged administration for those of that is now combined in one position. The resolution and the law is still in draft form, so we're going to need to, it won't be showing up tonight. My goal is to have that come to the meeting, to the HHS committee meeting next month, where we can have an open discussion and decide as a committee if we want to recommend moving that forward. And I was reminded that at the topic of the department structure and whether we keep this merged administration in the future or we don't is all for public consumption. It's only if we start talking about specific individuals that we would go into executive session. But I will, as soon as that, I've been working with Chris and Rich, and as soon as that draft resolution and draft local law is ready, I will send it to you all ahead of time as soon as it's available so you can take a look at it and see how it's structured. So for next month is the goal. If without any appointments, if we could get a motion to approve the minutes of April 12th.
I'll move it. This is Kerr.
Give it a second.
Mark.
Okay, thank you, Mark. All right, any any changes or any issues? If not, all in favor?
Aye.
Okay. I'd like Kathleen actually to go first. She can do it in whatever order. You can talk about some updates if you'd like, or you can cover your one resolution tonight, which involves the WIC program. So whatever you'd like to do.
Great. Well, I will give a little bit of report out tonight because I can talk about some things that are not COVID related for a minute. I think what'll be nice, I'll share with the legislature, we got some nice pictures for our Bike to School Day, which is an injury prevention program. There was an event held at the end of last week at Moravia Elementary School, and they're great. They did a nice job. We appreciate the Moravia School sharing the photos with us. It was really cool. Lead prevention efforts. We are making a concerted effort. Obviously, we haven't been able to do a lot of our lead programming stuff to the extent we had at one point when COVID was in full throttle. But we are making a conscientious effort to get back to our lead poisoning preventive work. And what we are going to start doing upon availability of our staff members is to provide assessments in people's homes, be they rented or homeowner occupied, with homes that might have children. So you don't have to have a child who lives in your home. Maybe you're a grandparent where there's a child who comes frequently to your home. And if you are concerned about lead paint or lead issues in your household, we will provide you an assessment in that home as we're available. We're going to start focusing with children 6 and under initially. And of course, if there's ever a lead poisoned child, that will always take precedence. We also have our septic system replacement fund has been renewed. Hold on. I'm at home and there's a little noise in the background that's making me insane. So I don't know if you guys can hear it or not. So the septic system replacement fund, these are for homes within 250 feet of the water in Owasco, Cayuga, Lake Como, and Skaneateles lakes, because it's unfiltered drinking water. Owasco, Cayuga, and Lake Como because they are considered drinking water sources, as well as impaired designation by the DEC. There are applications online. We definitely encourage people to take advantage of this. We can use it until the money's gone. There is a limitation. There's a cap on the amount of money that you can attain, but it's up, it's a decent amount. So it's well worth people looking into further. And then I will, of course, I would be remiss not to do anything about COVID. We are continuing clinics. We are seeing a diminishment in the number of cases, number of people attending our clinics. Same with the number of cases. Still getting some on a daily basis, but they're not sky high numbers. They're in the teens typically on a daily basis. We have reached out to our schools, all the school districts. They are surveying their school communities to see about interest. We just heard today, I saw there was a news blurb that there has been the emergency use authorization given for Pfizer for ages 12 and up. So we're going to do our best to try and provide some sort of accommodation and service to our community and our school age population of 12 and up. Brenda Wyman, Nancy Purdy, and I today also had a more lengthy conversation about homebound vaccination. There were a few points we're continuing to pursue, but we did decide we'll utilize the health department as a point of record, a point of contact to get on a list. We're going to put together a spreadsheet that we're going to share not only with the Office for the Aging, but with other entities that work with homebound populations or caregivers of homebound populations. I think Brenda really raised a great point. Sometimes you might be home caring for someone, for example, who may have advanced dementia. That person, the person with dementia may need a vaccination, but it's just as important for the caregiver to get it. And we really want to encourage that. So we'll be collecting names, but we're also going to be reaching out to, we've connected with our Lifetime Care. We've got to develop, they're a certified home health agency. We're going to develop a little bit more policy around this and reach out to a few more entities who may be eligible to provide the vaccinations at home, because it really is a logistical tangle, right, that we need to address because of the number of doses in a vial and how long the vials can be at room temperature and things like that. So it's very much a work in progress still, but it is a work that in progress that is moving forward. So we're happy about that. And promotions about getting vaccine. You know, we're working with the city and the health equity group, and we like some of the videos that they're in the process of developing. Aileen McNabb Coleman, our chairwoman, and I were also asked as part of a NISAC and NISHO initiative to do a video recording and send it into our NISAC office. That's the State Association of Counties. They're going to do a montage really of different counties. So we all read from the same script. And so that'll be interesting. We'll certainly share that with everyone when that montage becomes available. And then that would take us to our WIC program. We do have a resolution with a request to enter into contract with ABC Cayuga to have a 5-year lease agreement with them as we move into the North Street offices. I'll call it for, I'd be remiss on that address. So a 5-year lease agreement. We were fortunate we could build in some of the build out costs into the first 3 years of the contract, and then drop it back to just a cost of living increase at our covered. I'm happy to talk in more detail about what you might have about this.
Well, I could say just, you know, basically there was some communication sent out ahead of time to the committee members with some background. Yes, you know, ABC Cayuga through Meg O'Connell, you're trying to actually cover the costs of the work that's got to be put into the upgrades of the space. And that was the hope, that you would cover it over a 5-year period. And that, you know, this year, as you see in the resolution, you know, this is more rent than you're paying currently for WIC. That's why you're moving some money from your health department budget into that WIC line to make sure that things will work out, and that you had communicated. And I think that's been sent around that, you know, the RFP for WIC, it's the department's intention to actually ask for additional rent to cover those costs for this move. That's fair to say?
That is correct. Yes, that is correct.
Okay. Any other, well, let's get two things. Let's get a motion for HH2 and a second, and then we can have further discussion. And then if there's any questions to some of this information Kathleen reported on, we could cover that. So would someone move HH2?
Nightingale, move.
Okay, can I get a second?
I'll second. This is Kerr.
Okay. Any questions about the resolution for Kathleen?
I had a few, Elaine.
Okay.
All right. Hi, Kathleen. Thank you for your report tonight. With the WIC space, I was just wondering if you could talk a little bit about the difference between in the space from where you are now to where you're going, and some of the advantages to relocation.
Sure. Well, thanks for asking that. And I did ask Tanya Young, who's our WIC coordinator, to be on tonight. So if I say anything inaccurately, Tanya will correct me. She's good about that. We're thrilled. First, the relocate. So some of you may know, I hope all of you are aware, that currently our WIC office is located on the second floor in the historic post office. That has been the office since WIC opened nearly 50 years ago in our county, and it certainly suffices. We've made it work, and I can't say enough great things about the WIC coordinators who've really spearheaded the efforts to keep these offices, along with our buildings department, right, in great working order. ABC Cayuga, as many of you know, is an organization, it's a not-for-profit that was initially started up to help young families and kindergarten preparedness in our community. I'm oversimplifying, but there were surveys and assessments done. They really showed that there was a lack of engagement for younger families, particularly those with children age 6 and under, to not only get to know each other, but to have a place to convene, a place to learn, really cool things. And so this is where play space had been developed. ABC Cayuga also, the organizers there had started up the Dolly Parton Learning Library and things like that. So they're just a wonderful, they had sponsored our Nurse Family Partnership Program. They're a wonderful organization. So their play space is currently located downtown, and it's really outgrowing the space there. So strategic planning was performed, some real, thoughtfulness went into this effort, and the building on North Street that I call it the old Blockbuster building, it's near K&S Car Wash, across from Holy Family Church, Genesee Garden area. It's been purchased by ABC Cayuga. Play space is going to relocate into the center of that building. And so this is really going to become a destination for young families, which we're just thrilled about. WIC will complement the age group and the services that are often provided not only as a social center at Play Space, but a lot of times we do early intervention visits there. There might be young family support groups, breastfeeding support groups. It's really, birthday parties are there. So by co-locating WIC, it just is a natural partnership there. It will provide greater accessibility for truly physical accessibility. It'll create better visibility. It's going to be simpler to identify where to go. It's still on the bus routes. It's got great parking for people who park. It's got so many pluses. Also, WIC clients have been afforded the opportunity to have memberships to the play space. If you are a member, if you participate in WIC, you automatically are eligible for a membership at the play space. The play space is also ABC Cayuga, and the play space are also looking for a third building rental, and they've got some ideas for another early childhood entity, but that's not nailed down yet. But also the Child Care Council has their offices in this place also. So it's really going to become a destination site for young family services that we're just so pleased. This had to be approved by our state oversight for WIC, and they have really been extremely supportive of this relocation. It's been a challenge over the years, and Tanya could probably speak to this also, and her predecessors as well, because of our current location, the historic post office. Sometimes confidentiality had been an issue, and then the accessibility issues and hours of operations. And now we're going to be able to just be in the visibility, accessibility, and service, we believe, is going to be so much more conducive to our families that we serve. So we're just thrilled with this opportunity.
I just was curious. The WIC membership that you're referring to is through a partnership with the Department of Social Services Flexible Fund. Is that how the $85 gets paid?
It is. It is how the membership is afforded to our WIC families. And it's really a great opportunity, because at ABC Cayuga, you want everybody to be able to participate there, not just the people with certain financial means. And with the staff who work there have real early childhood development skill sets, and they teach families how to engage with their children of all ages. and often can identify sometimes perhaps a referral might be beneficial to early intervention, and they might encourage a parent to reach out and do that. So there's a lot of great health preventive type benefits to the families that are engaged with our play space.
Okay, any other questions on the resolution?
I got one question. I just joined the meeting. I'm sorry for being late.
All right, that's fine. Go ahead, Tim.
How many families do we serve from WIC?
Tanya, are you able to speak to that at the moment? I could give you a rough estimate, but Tanya might be more exact.
Yeah, our current caseload is 1350, so 1,350 right now per month.
That's a lot of people.
Yep.
Okay, thank you.
Any other questions?
Just
Okay.
ask a follow-up to that, Elaine.
Certainly.
With regard to the current caseload, I was just curious, how are we in terms of enrollment with the eligibility of families? What percentage of families that are eligible for WIC are actually enrolled in WIC? And is that one of the things that you're hoping this co-location would achieve is increased enrollment from families that we're not currently serving?
Certainly, we hope for that. I'm going to again defer to Tanya if she happens to know that. She often speaks with our Board of Health and will prepare those statistics for us.
Yeah.
So she may have those
Tanya,
available.
do you have a caseload number you want to achieve, a goal that you have?
Yeah, our goal right now is 1,500. And we've actually been steadily increasing really ever since COVID. These are some of the highest numbers we've had. So we're almost 90% of our caseload right now, which is great. Well,
Do you think that has to do with face-to-face not being required?
so we know there's some limitations with the way services are provided. Some things we have control over, some things are just state policy. But we definitely are taking advantage of the fact that we can do remote appointments.
Yep. Okay, any other questions? All right, if hearing none others, can I get a motion? In a second, we did. Can we get a vote on HH2?
Aye.
Aye.
Okay, aye. Any opposed? Great, thank you.
Thank you.
Brenda, if you're on and you want to get through your one resolution, that would be great.
Sure. Yeah, my resolution is just to accept some more funding. I think this is American Rescue Act funding. And it's specifically targeted to our meal program because, as I've reported, our meal program continues to grow, not only because of the increasing number of older people in the community, but because of various, COVID-related circumstances.
Okay, great. Can I get a motion for HH1 to accept those funds?
Nightingale, motion. Move.
Second by Lattimore.
Okay. Any questions? All in favor? Aye.
Aye.
Opposed? Hearing none? Great, that's passed. Thank you, Brenda. Do you have any specific thing else that you want to add on to Kathleen, or?
Nope, well, we're going to continue conversation to continue to work to find those folks out in the community that are homebound and in need of vaccines. And it's great to work together.
Great, thank you. Okay, Ray, we have HH3. If you want to go over that first, and then if you have anything you want to share with the committee.
Sure. So this is a longstanding contract we've had with Huntington Family Center. They do work for us related to juveniles that have sexual acting out behaviors. It's been reduced over the last few years. The Child Advocacy Center has some federal funding that allows them to do some of this work, but they don't do They don't do the risk assessments, which is something that family court orders quite a bit for us to sort of, as the Department of Social Services, conduct and then provide the information back to the court. So we changed this to pay for units of services, and it's a good contract. They work with us. It's kind of a renewal, but it's, like I said, been reduced over the last number of years.
Great. Okay, can I get a motion for HH3 entering into a contract with Huntington Family Center?
I'll move it.
Okay, can we get a second?
Nightingale, second.
Okay. Any questions? All right,
I
favor?
just had can I just ask a quick one? Ray, was this for kids in foster care, or is it preventative? What population are we serving with this?
So most of the time, the referrals come from family court. So it's usually related to juvenile delinquency petition or a PINS petition, where the behaviors, sort of where there might be some sexual acting out or some other sort of stuff. But we use them, pretty much any kid that we hear about or learn about, or a family that has some stuff going on, we'll use that to get a sense about what do we need to do to, first off, what is the, where's the kid in terms of, their sort of development around these areas, and are their behaviors kind of serious or not serious, and what would be a good course of treatment. Helps us sort of establish risk, particularly with kids who are in school and stuff like that. So it would be used. Generally, it was originally for family court cases, but we've sort of expanded that to sort of provide assessment and an understanding of a particular kid wherever they may land in the system. This is part of our whole strategy of being able to provide comprehensive services to every kid, no matter what door they walk in.
So the court might ask for this assessment while they deliberate what to do with the case even, correct?
Yep, exactly. Also
Okay.
helps. So there's foster care kids, all kinds of kids, go, you'd be surprised actually how much it gets used in both places, at the CAC and at Huntington.
Yep. Okay. All right, we have a motion and a second. Did we vote on this? Can I have a vote?
Aye.
Okay.
Okay, any opposed? Okay, great, thanks. HH3. Do you have any updates you want to share, Ray?
I can talk a little bit about the rental assistance
Great.
that we've sort of been working on over the past couple of weeks. So
By
I guess
popular demand, actually. People were hoping to hear about this by popular demand.
oh yeah, I didn't get any gifts or anything that would.
Well, it depends on how good the report is.
Yeah. So so the information that we sort of don't have all the information right yet from OTDA. We know that there's a regional allocation. Some counties, some places 200,000 residents and above ended up getting direct allocations. They had a direct allocation some months ago. So like if you see the paper or you look at the Onondaga County website, you see that they're sort of up and running and processing applications because they have their own money that was sort of given to them. And there's some other municipalities and counties in New York State that have that. In our situation, OTDA, what they've said is, they're going to sort of create this portal that they're going to manage, that they're going to have phone banks, and that portal is where all the applications will be inputted and processed, eligibility, the determinations, and then checks cut to landlords. So that's not up and running yet, so that's still under development. When we first heard it was supposed to be live sometime in the middle of May, we don't think that's going to happen. So we know generally speaking that people who have been impacted by COVID that are 80% or less of income, are eligible for this. There's some priority populations underneath that, so it's going to be like a 2-phase rollout from OTDA. The first this is what they're saying today. The first 30 days of this portal being open, really going to be dedicated to, these priority populations. And then after that, it's going to be opened up to everyone. So it's kind of be a first come, first serve sort of application process. So, they've made some funding available to counties. We have $120,000 of funding that we're not, we have to figure out how we're going to get it here and all the contracts and all that stuff. So we're sort of working on all of that. But we started, so we know that this is going to happen. We know that there's 12 months of back rent that can be paid. We know that 3 months of prospective rent can be paid. We know that hotel stays can be paid. We know that moving expenses and storage expenses and all of that stuff are eligible payments. And we know that utility arrears can be paid as well, because not everybody who's fallen behind in their rent are necessarily HEAP eligible. So we know all of that sort of stuff. So we kind of are putting together, we met with our partners. We have many that work with rental assistance, homeless services, rapid rehousing, all the typical sort of, agencies that do that work. So we've been meeting and talking. We had to submit a plan to OTDA about how you're going to do this outreach and engagement, public relations sort of effort. And that was due on Friday, and we submitted that, and we expect to get some comments back and negotiate on that. It looks like, the last that we heard was they were shooting. So there's supposed to be this webinar that they're gonna put out there that's gonna give us some more information, and that was supposed to happen last week, but they just started shooting the footage for the webinar, I think end of last week, so it's not ready yet. So I expect to have more information, more specific information, about how this thing works and all of that. So what we did was, we sort of trying to figure out a way to push out as much information as we can based on what we have, the information that we have. So there's a website, there's a web page built on the county website. We want to steer as much traffic there as we can. We're going to have signage on buses, signage in the bus shelters where people wait. We're going to have some billboards in high traffic areas. We're going to have what else is it? The banner downtown, press releases, all the social media stuff. I think the state indicated that they were going to take care of the social media stuff, which is making those ads pop up. You know how that works when you look at something on Amazon, and then every email that you get has a link to something that you looked at or sort of moved past. So the states, so we're not even sure like what that looks like. So we're going to have a number. We're going to have a hotline number for people to call. Cayuga Action Agency is going to sort of manage that, because they've got the original funding from the earlier money, and they have staffing that are attached to that pile of money as well too. So we're going to contract with them to run the phone, the number. They're going to have people that answer it and provide support. There's going to be some mobility, and Chapel House is going to also lend us some of their care managers. And Rescue Mission is going to lend us some care managers. So we're going to have this sort of centralized place where people can do their applications, and we're going to have mobile outreach. So we'll be in the north end of the county, the south end of the county. We'll work at the towns and villages to sort of figure all of that stuff out. We'll be taking appointments and going to people's houses to sort of help them do the application. The city of Auburn has a landlord registry, and we have a list of landlords that we make monthly payments to. We're going to send them direct mail that gives them the information that they need as soon as we get it, right, with the phone number for them to call and all of that. And we were thinking about putting flyers in Meals on, talking to Brenda, putting them in the Meals on Wheels packets, for people who receive the meals, scat van, libraries. Really sort of saturate the county with opportunity for people to sort of connect and get the information that they need. So we're really just sort of preparing everybody, like, this money's coming, this opportunity is coming, start putting your.
And all of this is part of that 120,000 you guys accepted through emergency resolution that helps to get all this off the ground and paid for?
So it's like a two-phase sort of thing. One is to get the word out, so you'll start seeing more of that now. And then when we get more specific information, we'll publish that as well. Try to steer as many people to the website as we can for the updates and alerts and all of that. We'll do a bunch of direct mailing. We also are going to send something And one of the things that we did with the Narcan distribution through the healing communities, remember this, Elaine, we sent something to every household address in Cayuga County, a mailing like that. We're going to send this, we're going to do the same thing for this. So some of these folks are going to get 2 or 3 or 4 notifications that this money is available through different listservs that are maintained by different folks. We're working with the housing authorities. There's quite a few people in the housing authorities that are behind in their rent and at risk for eviction and stuff like that. We also partner with Auburn City Court. The judge was able to consolidate all of the evictions in all of Cayuga County to come through Judge Thurston's court, whether it's a city or county, part depends on where the case comes from. We have staff that sit in on those hearings. There's also
Did I hear, or did I make this up, that there has to be a link between their eviction or their inability to pay their rent and COVID? Is there have to be a link in there?
Yeah, there has to be, it has to be related. Now, OTDA is, in a lot of the counties they're allowing us to interpret this broadly, just like the sort of the eligibility documents, right? How much your rent is, what your income is, all of that sort of stuff. There's going to be broad flexibility in terms of what people have to provide. I think on some level, it's probably going to be a simple attestation. They really want to move this money because there's another pile of money coming afterwards that will move the same way. Landlords can also apply, so they can initiate the application in the portal, and we want to encourage them to reach out to their tenants and help, and also make sure that they know how they can get help for their tenants to help to do the application and get the documentation squared away. So we're sort of gearing up to be able to pull all of this off in a very condensed. I would imagine all the money is going to be gone, and if it lasts a couple of months, I would be surprised. And then there's going to be another wave coming, so that money applies to sort of both of those. So the partners are really excited about this. They're very engaged. Everybody's willing to pitch in and lend staff, and we're starting to develop the contracts and negotiate with the different entities about what they can do, and then try to knit it together in some organized sort of way. So I think the central phone number, the allocating of resources being done that way, and I think I feel a little frightening in the beginning. You know what I mean? It's not something we do every day.
So individuals can apply and landlords can also apply on behalf of the individuals or on behalf of themselves not having any income coming in.
Yeah, they can. That's the thing. Like, we're not exactly sure what that means, but we know that landlords can do some of the application part, but can't finish it. It's going to require the tenant to participate in some way, but we don't really know yet what that looks like. We really don't know what, we really don't know yet.
Yep.
And we hope to learn more. So we figure we just start getting the word out, getting people alert.
Moratorium is still in place till when, Ray? At the end of
August 31st. Okay. I'm not sure what I know that there was a federal circuit judge overturned the federal eviction moratorium. I'm not sure what that impact is on the states. I do know that what's different about, we essentially have 2 piles of money. We've got this first pile of money that came through for rapid rehousing, which is getting people out of motels, getting them into permanent housing, and also doing some of this work, right? Paying back rent. It's a little bit more restrictive in terms of how far you can go back, but they have to have to access that funding. They have to have notice of eviction. The money hasn't moved in that way because there's no notice of eviction, because there's no eviction proceedings. This money, it doesn't need to be an eviction proceeding at all to sort of access. So the moratorium doesn't matter in terms of a landlord or a tenant accessing this particular funding stream, which is different than the other ones. And so it's sort of developing day by day.
Yep.
That makes sense.
Other questions for Tim or for Ray?
Yeah, I got a question.
Okay. Go ahead.
Ray?
Yep.
Who'd you call on, Elaine?
I called on you, Tim.
Oh, thank you. Ray, I had a situation where a young couple, they were renting a house and then they left the house, but they left the mother in the house with no means of taking care of things, you know?
Mhm.
Hello?
Yeah.
And is there any situation that can be fixed on that or no?
So I would encourage anybody who was in any kind of a situation that was destabilizing their housing to make an application through the portal, because there is some, again, like we don't really have complete clarity about how it works, but we do know that rent from a place that's been vacated by people is also eligible for reimbursement to the landlord. So there may be some way for you know what I mean? There might be some way in this portal to sort of apply in a way that the mom, right, the mom who's left there, to get some rent relief as well too. So it's just hard to, because they haven't really, haven't received any guidance or specific instructions about this at all, other than like, you know, a couple half-hour phone calls over the last 3 weeks.
Thank you.
Other questions from anybody?
Hey, this is Mark in Chambers.
Yes, hi, Mark. Go ahead.
Ray, is there any relief or anything for a small business that rents, who's, you know, possibly behind or delinquent? Is there anything for small businesses?
You mean from a commercial rent perspective?
Yeah, you know, it would be like a small business, they rent a building, you know, for their business and, you know, they're behind or delinquent, would they be eligible for something like this?
No, not this money. They wouldn't be eligible for, but I would say reach out to the Chamber of Commerce or CETA, because there's all kinds of money flowing, and I know that there is help for small businesses. I just don't know what it is, because it doesn't land in our wheelhouse over at the Department of Social Services. But I think there's opportunities for small businesses, just not with us.
Okay, thank you, sir.
Yep.
Other questions?
I had a couple.
Okay, Trish.
Hi, Ray.
Hey.
There may not be any guidance on this yet, but I was wondering if there was any information about looking at the continued affordability of these the housing for tenants that are applying for back rent, and then more importantly, I guess, rent going forward. Is the state going to assess that and making decisions about funding? Is there a relocation piece that's part of this if somebody's financial situation has changed maybe permanently because of COVID and now they need to get into something more affordable?
We don't know. I think that's a question that the commissioners have raised. We haven't really got a clear answer. It doesn't really do much good to pay the back rent, right? I think that's kind of what your question is. If you pay the back rent and you pay 3 months in advance, but the people who live there can't afford to stay there, then they're just evicted at a later date. So we're wondering about that as well too, because one of the things that the department does when we evaluate, you know, benefits for people and their housing allowance and all that sort of stuff is the affordability of the apartment or the house that they're living in. We assume that that's going to be part of it, but they haven't really been clear with an answer yet. As soon as I know more, I think as we learn more, my plan is to share it with you guys as we go forward.
And a follow-up to that is DSS's role primarily in helping to market this to the community, or are you anticipating any kind of a review role for the residents or landlords that apply here in Cayuga County? Will there be any local input into decisions that are made, or is it truly all through the state and first come, first serve based on their priority populations?
It's all through the state. First come, first serve. They're determining the eligibility and making all the rules and determining the, the benefit, the value of the benefit, and then dispensing with the checks. I see our role as being twofold. One is obviously to market this in a way that we push as many people into the portal as quickly as we can, as early as we can, so that Cayuga County residents, both landlords and tenants, get their fair share, and we sort of forestall as much displacement as we can. Second part, I think our role is going to be is people are going to come into the Department of Social Services because that's what they do, right? They come in and they say, "Can you help us?" So I imagine that we'll be assisting people with their application in the portal as well. We won't, if somebody comes into the Department of Social Services, we're not going to send them over to Cayuga Action Agency or to, Chapel House or someplace like that to fill out an application. We'll take care of that right when they're in the room with us. But yeah, we don't really have much. I mean, this is the way the state decided to do it, and they didn't ask us what we thought.
Well, I appreciate the update. Thank you.
Sure, you're welcome.
Any other questions for Ray? Great, thanks, Ray.
You're welcome.
Unless there's other business, we could entertain a motion to adjourn.
Move.
Yeah.
Make a motion, Mark.
Okay, can I get a second?
I'll second.
All right, have a good night, everybody. This is a record.
Good night.
Night.
45 minutes to kill for my next meeting.